Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, education funding has been a significant problem in the state of Pennsylvania for many years. We're going to delve into that, and then a health care update, all of that and more after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to Pennsylvania Newsmakers. Terry Madonna here for the program. Well, as you know, education funding, it's one of those reoccurring issues. At times there's an opportunity to change the mechanism, how funding gets produced by the General Assembly. Joining me to chat about this is Ron Cowell. He's the president of the Education Policy and Leadership Council. Do I got that about right? Center, I should know that. At any rate, full disclosure here, I'm on Ron Cowell's board. I don't get paid for it. It's an unpaid board. They don't support candidates. They don't get. I got
nonpartisan, independent.
Nonpartisan, right? Independent. Just want to get that cleared up for. All right, former State House member, chairman of the Education Committee. All right, let's go to the heart of it. What's the problem with education funding in the state that you're trying to address?
Well, the problem, Terry, is that we don't have a system, there's a person named Molly Hunter who works with education funding issues nationally, and she spoke at one of our conferences about 6 weeks ago. And somebody asked her, what's the better system or the best system in the country? And she said she never really has a clear answer for that, but she says one thing all over the country to courts and to legislatures. She said, don't do what they do in California because they have a bad system, and don't do what they do in Pennsylvania because there's no system at all.
So when you say no system at all, the legislature appropriates money for school districts. It's a lot less now as a percentage than it used to be. What's the percentage now about?
Now it's about 35%. We're among the bottom 6 or 7 states in the country.
So local school districts pay
a lot more. The burden is on local taxpayers to fund this public education system in Pennsylvania, more so than in practically every other state in the country.
And that's why this whole issue of property tax relief has been such a big issue, right?
It's politically popular to do something about property taxes, but a lot of us will argue that that's a symptom of the underlying disease, this rotting school funding system that we have in Pennsylvania. We actually have not had a system from year to year since 1991. Back then, until then, there was a system that the legislature really was not fully funding. Finally, in 1991, it was completely abandoned. So from year to year until now, the approach of governors and legislatures has been to make sure every school district gets what it got the year before, and then they fight over another $100 million or a couple $100 million.
So in other words, the other school districts, the school districts that would get what they got last year and then get a little bump, an increase for whatever money is available, basically on whatever money is available in the budget.
We've not had a formula where there was any responsibility, if you will, on the part of the governor or the legislature to properly fund the schools. They work it backwards from what happens in almost every other state. They decide how much money they want to appropriate, and they fight over a formula.
Okay, so in other words, there's been this drop. Local school districts are paying more, which means local taxpayers are paying more out of the one of the most unfair taxes, property tax. And so why is now a good time to change the system?
Well, let me mention one other thing about the problem, because it is important that we note that we're overly dependent on real property taxes. But the most damning thing about this non-system that we have is that we have one of the most unequal systems in the country of opportunity for students. We have 501 school districts in this state, and some districts spend $7,000. Some are spending $17,000 per kid. And this is important because we are now in a system where we have common expectations for students all over the country, or all over the state. We have these statewide academic standards, and we have very unequal opportunity for kids to be successful relative to those standards.
Why is now a good time to do something about this as opposed to 10 years, 5,
Well, we've got a convergence of 3 or 4 things. One, the legislature mandated a costing out study in 2006. That report came about in 2007. It is linked directly back to the state's academic standards. It answers the question, what does it take financially to give every kid a reasonable opportunity to accomplish these state standards?
So you have a study that a rationale for doing this.
And an answer to the question, how much does it cost?
Oh, okay.
And then second, that's provided in the costing out study.
Okay.
Secondly, we now have a statewide campaign, an unprecedented coalition of education and education advocacy organizations that have come together over the last 6 or 7 months, committed themselves to a campaign, and have active strategies of working with editorial boards, working in the Capitol, and working at the grassroots level. And then most important of all, and we need to talk a little bit about this, we have a governor who has put forward a bold proposal.
All right, we're going to run to a break. I think we're going to get to that proposal. That's the meat of it, right?
Yep.
That's the heart of the matter. All right, we're chatting with Ron Cowell, the former chairman of the House Education Committee. We will be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're chatting with Ron Cowell about now we're going to talk about the governor's proposal for this for funding that comes out of this costing out study. All right, what is it that the governor wants to accomplish in this program?
Well, the governor, first of all, very importantly, has proposed putting into place a system, one that we've not had since 1991. And that's the most important piece of his proposal. And why it is so important is that it is, first of all, provides a system so there would be some predictability and some commitment, if you will, on the part of state government from year to year to year. Secondly, it's linked directly back to the state's academic standards, linked back to the costing out study, which was asked to answer the question, what does it cost to enable all kids to accomplish proficiencies relative to these state standards? So the governor proposes a very rational system, and secondly, he makes a significant proposal to begin to fund it this year and to fully fund it over the next 6 years.
Is that the? I mean, one of the we've done some programs on this previously, and one of the controversial aspects of the program is the amount of money that this increase would call for. How is that being received? I mean, you know, state government as well as anybody, you know how difficult it is to get huge increases in any sort of portion of the budget. How is that generally being received?
Well, the governor's proposed over 6 years about $2.6 billion and $291 million increase in this first year, the 08-09 budget year. Right. And frankly, there seems to be a pretty good reception in the Capitol about that. The big numbers are always a little intimidating, and there's always concern about how this fits with other competing interests. But I think legislators increasingly recognize that the state has a major obligation, that it is not properly honored to fund public education in this state, especially if we're serious about academic standards and tougher graduation requirements for all kids, and certainly if we're serious about creating equal opportunities for all kids. So I think the legislature gets it, and what perhaps is most debated is whether or not to put into place a system which then entails not only a lot of money this year, but it entails commitments over the next 6 years.
What's the funding mechanism? I mean, the obvious question, how is this going to be paid for?
The governor has made it clear that he's not asking for a tax increase this year, and he has said that over the life of this program, there will not be a tax increase necessary to fund his school funding reform system.
Is he taking money out of is it out of the general fund? Is it going to come out of just the operating budget?
It comes out, it's part of the general fund. As you know, funding, basic subsidy, and other education line items always are a part of the general fund.
So that's not part of any of these ideas that have been floated in the legislature for a while to eliminate the property tax completely and go to either the sales tax or the state income tax. These are ideas, as you know, that have been considered by the legislature for some time.
Those are other things the legislature is debating and you know, may or may not act on, but they're primarily about reducing property taxes. They tend not to deal with this issue of making sure that there are sufficient resources in every school district.
Let's before you go, I want you to address that. I mean, in all of the debate that we hear about increasing funding, until recently we haven't heard as much about this, what we call this equity problem, where some schools get 6,000, 7,000. What is it? 7,000 is the lowest.
7,000 is the lowest expenditure per kid.
Per kid, and then at the high level, 17. Did you
17
say?
or more.
17,000. So how, if left unchecked, if left undone, does this spell education disaster for the kids?
Well, certainly it means...
Particularly the kids who comes from school districts where...
The costing out study made it clear that there's a level of funding that's necessary, base level, in all school districts across the state. And then you need to have extra consideration for kids who have special needs, for English as second language kids, for poor kids. And they also suggested you need to consider regional cost of living differences.
Right.
With the exception of the special ed issue, all of those things are reflected in the governor's budget proposal.
Okay. All right, thanks for coming in. All right, we come back, we're going to do a health care update. We're going to check in and find out what's going on. Health care has emerged, as you know, as one of the top issues in the presidential campaign. It polls in this state as one of the leading issues, rising costs, covering a couple 100,000 Pennsylvanians that don't have coverage right now. Where does that all go? You'll find out in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program for a little health care update with Representative Mike Turzai. He chairs the House Republican Policy Committee, and Jim Redmond, he's a senior vice president at the Hospital and Health System Association. See, these titles are long, Jim. We have this all the time. We debate on this program all the time how long everybody's titles are. All right, Representative Turzai, look, let's go to the heart of the matter. Governor wants to cover, he's been on this program, some 800,000 uninsured folks in the state. We've got rising costs. It's, you know, cost versus accessibility. What's going to happen?
Well, good boy, Terry, great way of phrasing it. Let me try to be short and succinct. Here's where I think the governor is missing it. The governor has phrased it as an accessibility issue. We believe it's a cost issue. We want to make sure that health care is affordable. But it's also, I think, the governor wants government-run, government-mandated health care, and we don't. And Terry, I think this sums it up. I wrote a paragraph here. The governor ultimately wants government-run, government-mandated health care, and he pretends that you can provide health care that is universal, inexpensive, and maintains quality health care by having the government manage it and fund it with your tax dollars. And we honestly believe that government bureaucrats have never made the decisions about the delivery of health care better.
Jim, look, you're involved, your organizations are involved delivering health care. You have to take care of a lot of folks even if they can't pay. I mean, you do this routinely, your hospitals do this routinely, as do a lot of physicians in the state, I think. On this business of accessibility, what do you think needs to happen here?
Well, the biggest concern at the moment, Terry, is that the governor has linked the M-Care abatement issue, which is a program that has been in existence since 2003 to help physicians with their medical liability costs, along with his legislation to expand coverage for the uninsured. And we believe it's absolutely critical that those become uncoupled, and we address and extend the abatement program and actually retire the state-run mandated health insurance or medical liability insurance program. And so we got to keep doctors here, and plus we're having a very difficult time recruiting new doctors to the state.
Yeah, particularly in certain specialties. Yeah. Go ahead. Did you want to?
Well, Terry, I just want to jump on what Jim's saying. Ultimately, you know, what is health care? You have to have people in hospitals and medical providers who are there to give health care. If you don't have that, then, you know, your quality is going down in addition to real access to quality health care. And it's a real problem. The governor's hijacking this M-Care, which was reached by consensus. How many years back now, Jim?
2003.
2003, consensus among Republicans and Democrats that since we didn't get medical liability reform done as much as we would have liked, we got some done, but not as much as we would have liked, and the governor continues to be impediment on that. This M-Care liability, helping doctors meet those liability costs, has been a unified thing. He's hijacked it. He said to doctors, I don't really care if you're here or not here. I mean, he's basically said that. And all because he wants a couple sound bites on a government-run, government-mandated universal health care program. I think it's wrong. I really think it's wrong. Let's get the MCare done today. It helps hospitals, and it helps doctors, and helps other health care providers. Yeah,
but Jim, look, over the years, you and I, we've chatted a lot about some of these subjects. In the accessibility issue, the question is how are you going to pay? I mean, he does have this hugely ambitious program, and as you know, he started out with the different ways to fund the 800,000 people that he originally wanted to cover. This current program, I guess, is about, what, 250?
It's about
250,000 people. I mean, have you chatted with, I mean, what is your way, what is the way to fund it? What's the alternative to, let's say, using this fund, you know, that's supposed to go and help doctors with their, medical liability coverage?
Well, the fund that has been used to pay for abatement, the governor has proposed that you can do both. But the funding out of that particular mechanism is only one source of funding.
Yeah.
The House-passed version of the governor's program has a $120 million hole in it. I mean, there is lacking that to fill that funding mechanism. Plus, it requires $200 to $400 million per year from the federal government on a federal waiver. So there are still some uncertainties.
Yeah.
I think, you know, what we can say about what the governor has done is he certainly has sparked a very interesting and important debate about health care in this Commonwealth.
Terry, there is a fundamental, and there's a fundamental premise difference here between where I think Republicans are and where the governor is. First of all, the governor did not work with health care providers, hospitals, doctors, nurses to come up with his plan. It is a bureaucratically designed plan, and it misses the boat. He says he's interested in making uninsured covered, but the reality is his plan is going to promote crowd out. He is encouraging employers ultimately to drop providing coverage and go into government, and who can ultimately afford that?
Well, we're going to go
Republicans have a different perspective.
Yeah, we're going to go to a break. I want to switch gears. I want to talk about another aspect of health care in a minute, but obviously this is a huge issue in a presidential campaign. This looks like a problem in search of a national solution.
Yes.
Some of you may not be happy with what you get, in varying degrees, but it seems to me this problem is so big and overwhelming and tied to all sorts of other kind of funding ultimately for people who are going to get these services, whether it's Medicaid or Medicare, you know what I'm getting at, that it's probably, but would you agree this is a yes or no search in national solution as opposed to a state solution?
At best, the state can make very small incremental change.
National? You may not agree with it, but you think it should be approached that way?
Yeah, look, McCain and Obama have big plans they've put forth, one private sector, one government run. But
all right, we'll be back. Healthcare debate continues following these links.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hey, welcome back to the program with Representative Mike Turzai of the General Assembly. That's a good way to put it, since that's where state House members usually hang out, over in the General Assembly, and Jim Redmond, who's with the Hospital Association. All right, Representative, we'll obviously get, the governor's been on and some of his folks talking about this, so it's kind of balancing out the time that we spend on this, little difference of opinions here. Lower cost, what's your idea? What are your ideas?
We put together a healthcare task force. Scott Boyd from Lancaster.
Representative Scott Boyd.
Kathy Watson from Bucks, and a great team from across the state. And we think that you can help more people get insured accessibility and maintain quality and affordability if you lower the cost drivers, as Jim was talking about earlier. And here's just some of the ideas that I think are great. Wellness tax credits. cost transparency, making sure that there is a mandatory minimum package of insurance available so that people can go get individuals. Adult basic, retooling that to allow choice options like health savings accounts or health reimbursement accounts. And also one of the things, and Jim knows this even better, to expand the use of qualified health centers, particularly in a lot of the rural areas and inner city urban areas.
You know, I don't know if this saves costs, but it certainly, I mean, if it would be a cost saving, but improve accessibility, is to expand those people who are eligible to receive Medicaid, expand adult basic. I mean, there are programs in place now that would allow for, I don't know if you get any cost savings out of them because there's some debate about how efficient they are, you know, particularly Medicaid. But are there current programs that would provide accessibility if you just change sort of the eligibility and the income?
We maintain
Go ahead.
92% of Pennsylvania's population is covered by some health insurance. Most of it through employers for those of us who are employed or dependents of employed persons. Mm-hmm. The other is filled by Medicare, a national program, and then there are some key state programs, adult basic,
right,
the Children's Health Insurance Program, CHIP, and then Medicaid. Yeah. And we've always maintained, why not take an existing program and expand it,
right,
as opposed to creating a whole new bureaucracy which has its own costs.
Right.
And you could leverage and improve access to care or health insurance through that mechanism.
From your position as chairman of the policy committee in the House, do you think that expanding some of those programs would find a reception in your caucus?
If they were retooled, at least in part, to allow for more choice, more consumer choice, more personal responsibility and consumer choice is brought into the use of those programs. You can use savings accounts and reimbursement accounts as part of that package, and we think there needs to be more of that. I would also say this. We also think that there has to be liability reform. We really think that a huge driver in healthcare costs is defensive medicine and extensive court.
All right. We're out of time, but you know, we can do this liability. Jim has been on a number of times. We've talked about that before. All right, thanks for watching. We'll see you next week for another edition. And as always, stay well. You like that. Stay well.
Thank you, sir.